Well, welcome back, guys, to the Fill Me In podcast, where we dive deeper into the world of aesthetics. Hi, Nicole.
Hello, hello.
You're down in New Jersey, and I'm up here. We're doing virtual today.
Yes. How's the weather up by you guys?
It is hot.
It's hot.
Hot and humid. We've been having a lot of storms.
Really?
Like severe thunderstorms, and we actually had a tornado up here a couple weeks ago.
I saw that on your story.
Yeah.
Scary.
Like, this area called Rome, New York, for those of you that know Utica at all, it destroyed a lot of homes. Like, it's pretty bad. Yeah, I know. We never get tornadoes up here.
Weird. Weird
Nothing
things are happening.
No
tornadoes. So far, so good.
Oh my God. So guys, we're going to touch base today. Nicole and I went to Modern Beauty Con. So if you follow us on socials, you saw that we were there. We filmed a lot of different reels and content there. Modern Beauty Con takes place in Boston, and it was phenomenal.
Yeah, so much fun and so educational. I think we all really love the fact that all of their courses or classes, lectures, whatever you want to call them, were back to back. So you didn't have to choose different speakers that you wanted to see, which was incredible. And of course, the cadaver lab. Can't beat a cadaver lab.
Crazy. Yeah. And I loved how even beforehand going to this conference, you were able to download the app, the Modern Beauty Con app, and you could go on and you could choose the speakers that you wanted. Like, they had the whole list of the day. You could choose who you wanted to speak to. That way you had your own personal schedule, which was nice. And like she said, these people that were giving the lectures were some of the OGs in aesthetics, and they know what they're talking about. They've done their research, and they're people that Nicole and we look up to and we've aspired to be. So it was pretty amazing listening to them.
Yeah, it was a really good lineup. Yeah.
What were some of your favorite speakers?
Leslie Fletcher, always.
Always.
I think Erica Berry is always such a good speaker as well. Who was the one you knew right before I had to leave because my flight was canceled?
Oh my gosh. The functional medicine doctor?
No. She did the hyperpigmentation.
Sonia Ellis.
Yes, I loved her talk.
My God.
And she's amazing.
Even more amazing in person. She is who she is, and that's why I love her.
Yeah.
But yeah, she did her whole talk on melasma. She really expanded their treatments and how they treat. As we all know, in aesthetic, I mean, that's one of the hardest skin conditions to treat. It's something that's obviously a lifelong, treatment. But she kind of breaks down her way of treating it, and she's very transparent. She lets you know what medications they put them on, topically, what lasers they use, all of that. So it was super, super informative.
Yeah, and for me, like, we're just kind of getting into the laser world and all of that. So I just thought that was like so much good information. I loved it. I loved her talk.
Yeah. And Julie Kaplan.
Oh, she's always amazing.
I mean, I know you met her before.
Yeah.
Right?
Yeah.
At AmSpa that you met her?
Yes. Yep.
Okay. It was the first time for me. And it's just like, first off, she's so tall. Like, I had no idea that she's like 6'1". So I'm like looking at her, like, and she wears heels. Like,
she rocks it.
Oh my God. Amazing.
But what a great person too. Like, and her lectures are always like, I always learn something every time I see her.
Yeah, same. And I think her and Leslie I've kind of not copied, but I mimicked the way that they do their toxin, their Botox, and with their reconstitutions and their 2-to-1 to 1-to-1 and all of that. I love how Julie Kaplan breaks down the different areas that are normally injected in the face and what reconstitution she uses, the depth, all of that. It's just incredible, especially for newer injectors.
Absolutely. And I love too that she goes over all the complications. So like if God forbid something were to happen where you had like a lid ptosis or a crooked smile, she kind of goes over where to place the Botox to fix that.
And she normalizes it. I mean,
right.
Which is
because it happens to all of us. Yeah.
It does. We talked about that in one of our other episodes. Right?
Yep.
And that cadaver lab was incredible. It was my first one, not your first one.
Yeah, it's my third one.
Wow.
Yeah.
So how do you think it was compared to your others?
Amazing. I think it's really cool to be able to have all that time. Like, we really were able to kind of, you did one full side of the face, but then we were able to do the other side and really look at what we wanted to look at. And you just can't be injecting filler and dissecting down to kind of see where that filler ended up, Yeah,
and it was really guided by Dr. Sarek, this one. And I thought it was really cool. And I don't know if they do this in other cadaver labs, Nicole, but they had different like master injectors. Like they had people like kind of spread throughout the cadaver lab. So if you ever needed help finding a landmark or you needed help with anything, they were there to kind of help guide you and find the certain anatomical landmarks and things like that.
Yeah. And we had Hermine and Gorgeous by George. Love him.
Oh my God.
Such a great team. Yeah.
Yeah. Great duo.
Yeah. Oh, yes.
Oh my gosh. Love it.
Oh, yes. But yeah, great trip. Then me and Jon ate, drank.
Yes, we did.
Lots of dinners.
And this is a chance for people to really like meet other people in the industry. I think that was the other networking is so huge. So it was really fun to like be around like-minded people that want to learn, want to better themselves in this industry. And like, you know, a lot of these people were already like friends with on Instagram.
Right.
So to see them in person, we're like, oh my God, you know?
Yeah. No, that second night too, where they had the cocktail hour. That was like great networking.
It was so nice.
You get to meet everybody and really talk and chat and sit down and spend time really talking. We have a couple guests that we got from that night. Future pod guests.
They're coming up probably this fall or by the end of the year.
Yes, yeah.
Can't wait to announce that.
Exciting stuff.
Very exciting stuff. And I think what was nice about this, about Modern Beauty Con is that obviously I think Allergan sponsored them. I think Galderma sponsored them. Evolus. There were different pharmaceutical companies, right, or aesthetic companies that sponsored them. So it wasn't so focused on one, like one-sided. Exactly.
Yep. Yeah, it was very. You heard about all different products. So no matter what you use, you could really learn about new things.
Right, and that's how it should be.
Absolutely.
Yeah, I feel like as of late, like on social media, kind of like stemming into this, I feel like, and it's been a lot over the past, like I would say 2 to 3 years, like product bashing, which, and I feel like people are using product bashing in a way to get followers, like on Instagram or on TikTok, and a lot of it is spreading misinformation, and it's also spreading like negativity in the aesthetic industry. Like, what do you think?
Absolutely. Negativity, misinformation. I think too, when you're posting things like that, you have to remember that patients are seeing that. So they're going into the provider going, why am I getting this product? Because I saw online that it's awful. I think when you don't work with a product or you don't have great results with a product, I don't think it's fair to say right off the bat that that's an awful product. I think everyone has different hands, different techniques. And all products are made differently, obviously. But I think definitely it's more about the person behind the needle and the experience that they have with said product. I mean, I do.
You could not have said it better.
Yeah.
It's really, I think, the person behind it.
Yeah.
And I think, like you said, you can't just jump to bashing a product that maybe you had one negative experience with, and it might not even have been the product.
Right.
There's a lot of different factors. It can be us, like who, us, the person behind it. It could also be, there could also be a medical reason, certain diagnosis that a patient has that's causing filler to react a certain way. So yeah, I
definitely. Or like anatomy. I feel like if you're putting a specific product in a lip that should not be having it, you're going to have issues, 100%. So I think, definitely seeing a ton of that now, which is sad to see.
It is sad to see. And I feel like there's other reasons why I feel like providers pick certain filler companies to work with. I think too, sometimes like they might not have a great experience with like a rep or maybe there wasn't a rep at that time in the area. So, and then one kind of was there to kind of help guide them while they opened up their business. And so they almost developed a friendship or like a more personal relationship with them. Right. So, and then that kind of stems through. And I just think it's really important as providers, right, to do our own research and not just to hear birds chirping, but to do our own research, play with the product and develop our own opinion based on, what we're doing.
Absolutely. I was just going to say that too, because it's also who trains you. Sometimes injectors might get hired somewhere and they might be a one product place and that's their choice and their decision, but they might just be fed a little bit of different information than if they were to kind of get that unbiased, being able to play with every product and try every product.
True.
So it might just start from the beginning even without them even noticing.
Yeah, and let's just remind everybody, like Galderma, Allergan, Revenes, RHA. What else am I missing?
Evolus.
All of these are FDA, right? They're all FDA approved products. Botox, Dysport, Jeuveau, Xeomin, Daxxify, all of them are. And whether one practice is carrying one and one's the other, if they're carrying an FDA approved product, they're doing things the right way. Right. And we can't just bash them based on what product they have. And I think too, like you said, like say if practice really loves one product, that's totally fine.
Right.
But then say if they have a certain product in their lip and then another practice is bashing that said product, right? Then like you said, a patient's watching it and they're going, oh my God, I have that product in my lip. Is that bad?
Right.
And then it makes them lose trust in their provider, which isn't good.
Right. It's that spread of misinformation. It's, again, what brings our field so far away from
community,
that respect and that medical feel when we're on there, bashing and joking about certain products. It's taking away that, that like scholarly feel to it,
So true. And that's why, like you said, it's important to understand rheology, what products are meant to be in, certain areas of the face. Making sure if we're choosing a product for lips that it's supposed to be soft. It's not super hard. Things like that. It's good with expression, things like that. So, yeah.
I had a patient the other day come in and she was having issues with longevity with lip filler. And she had gone somewhere else and she came back to me and she was like, I just hate the shape of my lips. Like it just doesn't look great. It's holding, but it doesn't look great. Okay. And I'm like, what did they use? She was like, I think it started with a V. I'm like, okay. And it was Volux.
Wait, what?
Volux in the lips.
Wow.
And I was like, you're positive about this? And she had, and it was holding, but it did not look great shape wise because that's not Volux's job. Volux's job is to go in and take up space and be hydrophilic and cause projection. And it's not causing any type of, minor shape or border or anything like that to the lip. It's not meant to be there. So it's going to hold, but it's not going to look good while it's doing it.
Right. And for those of you wondering, this is a product that's FDA approved for jawline. So it's obviously, like you said, very cohesive. High G prime, meaning firmness is high. So of course it's holding well. It's providing a structure, but it's
not giving the shape in the meantime. But that's definitely when we say there's products meant for certain areas, that's what we mean. There's something for everything.
Yeah, of course. So like I think for patients watching or listening in on us is products like Juvederm Volbella, Juvederm Ultra, right? Restylane Kiss, Restylane Refine, even Restylane Define can be pretty in lips.
Yep.
Revenes lips, RHA 1 and 2. I
have no experience with RHA, but
Nicole and I don't have experience from what I gather from our friends that do use it. I think it's RHA 1 and 2, and please correct us if we're wrong. So there's certain usually every filler company has products that are FDA approved for certain areas of the face.
Yeah.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Nicole, there was that TikTok video that went viral that you sent me.
Yes. Yep.
I think it was Dr. Parsa was his name.
Yes. Yeah.
So what you're looking at here is an MRI image of a 33-year-old patient who had over 12 syringes of hyaluronic acid filler injected over the past 6 years. When we measured the amount of filler, the amount of volume that was there, it ended up being close to 28 cc, which is more than twice the amount of filler that was injected.
He did an MRI on a patient who had 12 mLs of filler. And when they did the MRI, the filler, it was upwards of like 20 mLs once
28 cc's.
Yes. Yeah.
It like expanded to encompass that much. Yeah.
And I think the video got so much traffic because people weren't expecting that. But if you think about how filler works and what it does, it's kind of doing exactly what it's supposed to do. Because filler is very hydrophilic. So when you place a syringe in there, when it settles, your body's going to pull water to it. So of course it's going to expand and be bigger. So I think maybe this video scared some people, but it's actually showing that, you know, the filler's doing what we want it to do. And if we're using the right products and in the right areas, it's not such a bad thing. I think too, longevity, people always hear like, oh, well, filler doesn't go away. We're learning filler doesn't go away. I feel like we always knew that to an extent. Maybe it wasn't educated to our patients as well as it should have been. And yeah, filler definitely is marketed. I typically say 12 to 18 months because you're not going to have that initial result forever. But there are studies out there that do show that filler can last up to 15 years.
100%. And I think everybody, I mean, people's metabolisms, I mean, there's so many variables that can cause the filler to break down, you know, quicker or last longer. And then it also talked about how that filler then caused tissue expansion. I think he talked about.
Yes.
And I thought that was really interesting. And I think it just stems down to proper education. I think we've talked about this before. TikTok, Instagram is a great thing, but the primary age group for people watching these videos, I would say is 20 to 30 and more or less 20 to 25, even 18. I mean, teenagers are watching this, right? And Nicole and I get patients all the time that are in their early 20s, even like 20 years old, and they're wanting jawline contouring. They're wanting a more projected chin. They want facial balancing at 20 years old. And I mean, how I word things with patients that are coming to me, especially, you know, I just had a 20-year-old that came in, and beautiful, beautiful girl. And I just said, listen, your face hasn't matured yet. And for me, come back to me at 25 years old, you know, when your face is matured. Please don't get filler in your face until then, like facially wise. If we're doing a little, which we have done her lips before, her lips are absolutely stunning. And they're lasting a long time. I think we only touch them up every 6 months now. But come back to me at 25 and then we can reassess and go from there.
Yeah. Yeah. I think definitely we do the same thing. I think 18, 20, 21, it's too young to be making these types of modifications. And a lot of the time when you're that young, I think you're looking, like you said, for a more sculpted jawline, or you want more contour to a cheekbone, when in reality, these products really are for that volume loss. So we don't want to be creating too much of a new appearance to you. It's more of, you know, helping that aging process and adding where it's needed and 100%. Not creating something new. So definitely like 25, 26, closer to 30 is where we want to start. Of course, if someone comes in and they have absolutely no chin and they're really recessed, we'll go and we'll build something like that for them because that's more of a balancing procedure. But no, I completely agree. When you're too young and you start off the bat with that and you just keep going, that's when we, you know, run into issues. And
100%. And, you know, we talked about how filler attracts water. Obviously, there's certain fillers in each family, like Juvederm, Restylane, Revenus, you have it, RHA, that probably attract more water than others. You know, like we all know that like Juvederm Ultra is a little bit more hydrophilic. Juvederm Volbella is less hydrophilic, so it draws less water. You know, that's why we use Volbella in the under eyes. So it comes down to rheology. And there's certain fillers that are meant for certain areas of the face. You know, so it's really important to go to a trusted provider that understands rheology and isn't putting Volux in your lips, and things like that, right?
Right. Yeah. That was a shock. I was like, what?
No, that's a new one. I mean, I've seen Voluma in lips before. And I'm not going to lie, in some patients, like it looks pretty good.
Yep. It's a final resort. Yeah. You got to sometimes end up there.
Sometimes you do if the filler's not lasting long and they want a little bit more longevity, but you have to have the right lip for that.
Right, you got to be the right candidate. Yeah, for sure.
For sure.
What is your thought on migration? I know we hear migration all the time regarding to lip filler, but like your thought in general on migration. I know PA Nicola has done a couple of videos regarding maybe like temple filler ending up you know, in that like submalar area. So I don't know your thoughts on, preauricular.
I think, my gosh, Now I don't have ultrasound in my practice, right? So I can't firmly or confidently say yes or no to that. If it is migrating, maybe it is, and I'm not sure of it. But it's definitely something every time my patient's in the office and I know they've had filler before, I'm always assessing their face. I'm actually always feeling it. Sometimes they don't know that I am. Like as I'm holding them and marking them for their Botox, when I did their cheeks a year ago, like how are they feeling? I'm also looking at their face shape to see how it is compared to what it was previously. But it's definitely something for me that I try to destigmatize with my patients, that once you get filler, there's always a chance of migration. We side sleep all the time. Okay. We bite our
Yep.
yeah, we bite our lips. We constantly rub our lips together, putting chapstick or lipstick, lip gloss on. Public speakers. There's some patients that have very, very thin lips, and their orbicularis oris muscle is just very strong, or it curls under, disappears when they smile. So patients that have those types of things, like for instance with lips, I always recommend doing Botox above the lip to relax that orbicularis oris muscle before I put filler in, so that way it lessens the chance of migration above the lip or in that wet border. But I definitely, especially for me, I mean, I've dissolved areas on my face that I've had filler before. I mean, it's very normal. It's just once you decide to get it, there's always that chance. And I think they talked about lymphatic drainage as well in that video.
Yes. Yep.
And that's also a really important topic, because whenever you're treating the under eye, anterior medial or under eye area, tear trough, there's always a chance of an interruption in your lymphatics. And that's why it's important for us to assess that area beforehand if there's already pre-existing swelling or puffiness, or festooning in this area. What do you think, Nicole?
Definitely. And I think for patients listening, what this means is in the under eye area, we have a little pocket. We call it the malar mound typically, but our lymphatic system kind of sits there. And especially our muscle plays a role too. So Botox can actually cause a little bit of lymphatic slowing as well, because every time we blink, it's kind of helping, pump those lymphatics. But if we add filler to the area, not only is the filler causing a little bit of an obstruction, but then it pulls water. So it's giving your lymphatics even something more to have to drain. So that's why we see it. And that's why product selection is huge. So I only use Vobella in the under eyes because it has a low water affinity. And I don't really run into issues. I think placement is huge. You don't want to be traveling through the mound. You want to just come up right where the hollow is. And I never do more than a syringe, to be completely honest, ever. Sometimes it's under a full syringe, split between both eyes. Yeah. So it's definitely product choice, product placement, and how much product. And when it comes to the temples and things, I've definitely watched a couple of Nicola's videos on that. And I think same thing, when we're spending all day chewing and drinking, we're using muscles in our temporalis muscles as well. And it can cause the filler sometimes to slide down or migrate a little. It's not going to be something that's visual. Like you don't always see that so much.
Gonna, collect.
Right.
Like mound.
But maybe a little bit of filler might end up somewhere where if we do these MRI studies or things like that, we might see it. But I don't think the patients always know so much. So again, that's more of like, you see it online and you might have a fear of it, but in reality, how often does it happen, or how often does it happen where it's going to cause a problem?
Sure. Of course. Yeah. I mean, I have Juvederm Voluma in my temples, which it's new FDA indications coming about this September, October. Super excited about it.
Me too.
And I haven't had any issues with it. I mean, it's not that I know of, and I'm always, staring at that. Always with a fine tooth comb.
Yeah, right. No, we do a good amount of temples too, and we really don't run into many issues. I know that their approval, I think, is going to be the one up, one down with the needle, but we honestly do a fair amount of cannula. I don't know your technique in that area, but I'm typically doing cannula.
I do a lot of super periosteal injection.
Yeah.
There, and I will do cannula. As well. You just have to make sure, obviously, you're blending, you're making sure you're in the right plane, and then that way, and you're also massaging, things like that.
Yeah, I think the cannula becomes a little bit more difficult for injectors sometimes because you are a little bit more superficial, and sometimes you can see the filler. So if you're not using the right product or knowing to blend or massage, you can end up with bumps and worms. Sometimes I call them worms. They're not actually worms.
Call them worms. Yeah. I know what you mean.
It's the visual filler in a line that looks like a worm.
When I had my temple filler, I had like a little area that I had to massage just for a couple days after, and then it was completely fine.
Yep.
Yeah.
But temples, I feel like, is an area that is going to, especially when they launch it, be so popular because it's an area
And
that
it's
people don't
a
really
high
think of.
risk area.
Yes. Yes. Make sure you're
And
going to a good provider.
good provider, but also, I mean, seriously, a provider that's done a cadaver lab. That was my first one, and that was so helpful.
Yeah,
So helpful.
no, definitely to be able to see it like that. It's so true because a lot of what we do it technically blind. You know, we're not seeing underneath the tissue when we're injecting. We are using our landmarks and what we've learned from the cadaver courses and things like that. But yeah, anything can happen to any provider, but you want to go to a provider that really has educated themselves and done the trainings. And
for those of you that don't know this, in this specific cadaver lab, and now, Nicole, is that every cadaver lab that you do or that we do, you inject first and then you?
In one of them I did not inject. So
okay.
Yeah.
So the one that we did, guys, Nicole and I actually injected certain areas. We injected the temple, and we did it supraperiosteally, which means needle to bone. And then we also did cannula. Then we were able to then dissect down and then spread those tissue layers apart and kind of see where the product is sitting. So it was really helpful to see that, just to make sure we're in the right plane when we're injecting.
And it was nice too, because at the end they kind of were like, you know, if you're someone that injects noses or anything like that, you can play around right now and inject and kind of dissect other areas that we might not have gone over. So that was really cool to do too.
That was wicked cool. Very informative. And everybody's vasculature is different.
Yep. That was the coolest thing. So when you go to these, you have like 4 people to a table and there's like 12 tables. So you actually do get to see how different everyone's anatomy is in real life because you have 12 different cadavers that everyone's working on. So they kind of go around and point out certain things. Like my cadaver had a huge facial vein, remember? It was like a balloon.
Oh my God. Yes. Huge.
So, and some people, it might be a little smaller.
Someone had that retromandibular vein that was huge, that runs right behind the gonial angle of the jaw.
Yep. Yeah, we saw some really cool stuff.
Why we don't inject this way when we do.
Jawline.
Yes. We inject 90 degrees.
And we learned, I learned, I mean, we all know that there's so many risks with fillers and our most common is the occlusion. Then you hear about blindness and things like that, but they've recently added pulmonary embolism and stroke to the list. And I was not sure why. I knew it was added, but I wasn't sure of the why behind it. And George went over that there are a few veins in the face that are valveless. So if filler were to get into a valveless vein, it doesn't have a stop. It just goes, and that's how it either ends up in the lungs or
that was so eye-opening. I mean, lungs, brain, eye, like it's just anywhere. Like depending on where you're injecting, it can, be involved in vasculars that can affect the eye or the brain. It's crazy.
Yeah, that's why I truly believe in one, cannula use as a provider, but also important. Small amounts. Like I never do a bolus over like 0.1, to be completely honest. I always keep it smaller amounts of filler because you're going to be at less risk with that.
Right.
So again, never to scare anyone. These are just,
oh gosh, no. Yeah,
things we learn.
Totally educational. And honestly, we're talking about that. We're being extremely big nerds right now.
Yeah.
we just love what we do. And this stuff just makes us so excited. This is what keeps us up at night, guys. Like we're on TikTok and we're watching videos of patients getting MRIs after they've had
filler
in their face. It's just crazy.
But to go back to that TikTok, so I think a lot of people saw that video and it almost scared them because it seemed like something that shouldn't be happening. But in reality, that's what we want the filler doing, and it's doing what 100%. It needs to do. And do you need more than 12 syringes? Probably not, because as we saw, it almost doubled.
And usually we lose about, is it a teaspoon of filler or a teaspoon of volume each decade?
Yes.
Which sums to about 5 syringes of filler a decade. So, say and this is after the age of 30, Nicole, right?
Yes.
So if I have a 60-year-old patient coming in, they've never had filler before, they've lost 5, 10, 15 total syringes, right? Or so in the face, which makes sense because we lose superficial and deep fat pads as we age. And we also bone resorption. We lose bone, which we lose that structure in the face. So,
Yeah, and going slow, I think, typically, I think we talked about this in an old episode as well, but I'll usually do no more than 6 syringes in one sitting. and then have them come back. I have multiple patients that I've done 12, maybe 14 or 15 on, but never in one sitting. I always give it 4 to 6 weeks, really let it settle, pull the water it's going to pull, and then do more from there.
Yeah, and that's why also it's nice that we have biostimulators like Sculptra or, hyperdilute radius a lot. That that's becoming very popular because every face is different. We're going to treat volume loss differently because you might, based on your facial shape, you might be experiencing volume loss more superficially. Right. That's where we can do more Sculptra or something like that. So there's a lot of options out there for patients to achieve their aesthetic outcomes.
Yeah. So I think our goal regarding talking about that video is to tell you guys not to be scared. It's normal, and it's actually results that we're happy to see.
100%. All right, guys, thank you so much again for tuning in to this week's episode of the Fill Me In podcast with me and the lovely Nicole.
Yes, thank you, everybody.
Yeah, and we'll see you next time.
Bye.
Bye.
All I want.